Hello, welcome to the learning modules brought to you by Therapeutic Articulations, the developer of the Mobilator orthopedic device. This learning module will focus on elbow mobilizations. The mobilizations that we are going to address for the elbow is the humeral ulnar medial and lateral glide, used for elbow flexion and extension, respectively, and the humeral ulnar anterior glide for flexion and pronation, and the humeral radial posterior glide for extension and supination. So beginning with the humeral ulnar glide, a medial glide is designed to improve flexion. It involves stabilizing the distal humerus with the elbow at 90 degrees of flexion. The therapist then places the thinner eminence of the mobilizing hand in contact with the olecranon and the ulna and applies a medial force in a downward direction with the forearm in line with the direction of force. This medial force in contact with the olecranon and ulna on the humerus and radius is defined as a medial glide of the humeral ulnar joint. This is the performance of that humeral ulnar glide in the medial direction using the Mobilator device, a device used to quantify joint mobilization. By attaching the custom-made attachment, the HE attachment, which is green, and you can see that green remnants there underneath the thumb of the left hand, by attaching that to the device, lining the device up with the joint line, one can very easily perform the same joint mobilization technique that you would do without the device, all right, with the Mobilator to quantify the joint mobility. This is a great way of being able to objectify the movements with a very simple learning curve here. No significant changes in the technique, using the device versus not using the device. Here's a little video showing that. You slip that green device onto the Mobilator. You find the joint line, you line it up, and then you use the same technique to impart that medial glide. And there's your oscillation at end range. For a lateral glide, it is the same exact position, except now instead of pushing, you're pulling. So for a lateral glide, you're simply moving in the upward direction again, using the forearm as your alignment with the direction of pull. A lateral glide is a way to improve elbow extension. Here's the green device, the HE attachment on the elbow, and it shows the clinician pulling up on your distal attachments, moving the olecranon and ulna on the humerus and radius. And that would be a humeral ulnar lateral glide. Again, here's a video attaching the HE device. You flip the device around now because now you're pulling up and now you're moving laterally. For a humeral radial glide to improve flexion and pronation, now you are grasping the you're stabilizing the proximal humerus, all right, with the elbow in about 70 degrees, a slight bit of supination, maybe 30 to 35 degrees of supination, and you're imparting an anterior force to the proximal radius on the humerus and ulna. So this grip that you see of the radius, all right, it is basically a pincer grasp. And when you move anterior, right, or what you might see in this picture as moving left, right, that would help to facilitate flexion and pronation. Whereas if you were in this picture to move to the right, that would be anatomically a posterior glide, and that would improve extension and supination. So always remember, we're talking about anatomic position. Regardless of where we position the person for the mobilization technique, our reference point is always anatomic position.
If you'd like more information about joint mobilizations, and specifically how to do these joint mobilizations with the Mobilator device, please go to mobilator.com for more learning modules. If you have any questions, you can email dawn@mobilator.com. Thank you for listening to this learning module.